Good afternoon. I am honored to be a part of FPG's anniversary celebrating providing technical assistance to support IDEA 0 to 5 for over 50 years, reflecting on the wisdom of the past, informing our work in the present, and inspiring the field for the future. Today, we focus on inspiring the field for the future. And as we think about the future of TA provision, I would like to bring us back to centering the lived experiences of the children and families we serve. The disability community is the largest minoritized group in the country. And because anyone at any time can become disabled, it is the most diverse community as well. The future of TA recognizes this diversity, providing culturally responsive services that demonstrate an appreciation of the unique challenges and assets of children and families related to their disability, but also a consciousness of how their disability experience is mediated by other identities. This is particularly important for disabled youth and their families who also possess other marginalized identities. In essence, TA providers must cultivate a critical consciousness of the ways in which disabled youth with other minoritized identities experience often overlapping systems of oppression and how they leverage cultural tools and assets associated with their multiple identities to navigate through those oppressions. I situate myself in this work of TA provision as a Black woman born with a disability, a product of public education, and a recipient of special education services. With over 25 years as a practitioner in special education, first as a school psychologist in Head Start programs and public K-12 education systems, then as an educational consultant in special education technical assistance centers, and now currently as the director of the Region 3 Midwest and Plains Equity Assistance Center, one of 4 federally funded equity assistance centers providing equity-focused TA to public education systems. I draw on my own experiences as being both a recipient of special education as a youth and as a special education practitioner as an adult. The challenges disabled youth of color and their families face in accessing culturally responsive supports is not just theoretical for me. I have lived them. And as I will hope that many of the barriers I navigated as a youth have been dismantled, unfortunately, we know today many of these challenges continue. When it comes to early intervention, we know these resources are often key to setting children with delays and disabilities on a path to long-term success. However, Black children with developmental delays are 44% less likely to be identified and receive services. Latinx children with developmental delays are 78% less likely to be identified as such and receive services. Children of color face barriers to accessing these services in all parts of the process. From screening, children of color often have less access to programs in which specialists are trained to use screening tools, such as high-quality healthcare and early childhood education programs, resulting in fewer screening opportunities. In evaluation, children of color living in low-income neighborhoods are less likely to receive evaluations due to the limited access to developmental screenings. And when they are screened and are referred for evaluation, they are less likely to be tested. This could be due in part to the limited supply of evaluators in their areas, although more research is required to determine other contributing factors. In early intervention services, children of color who are eligible for services are less likely to receive them and more likely to face challenges while receiving them. This is due to a variety of factors, including insufficient outreach and a lack of culturally competent service providers. Racial disparity is more pronounced among children qualifying for services based on developmental delays that are more difficult to detect and require observational assessments. Ensuring a future where all children and families benefit from TA services begins with accounting for and appreciating the multiple and dynamic cultures of the system. It is important that TA providers and organizations consider the multiple and dynamic cultures interacting, influencing how both practitioners and families experience TA provision. It is essential service providers consider the cultures that we all bring into the TA relationship and space. It's important to recognize the cultural histories and practices that are at play in every social interaction and social space. We also must consider the cultures that are already established. These are the norms, patterns of practice, written and unwritten policies, establishing rules for behaviors and expectations that are historically a part of an organization. In other words, the institutional cultures. And we must also consider the cultures we create. And this is the space of innovation. It is the work people do together, the cultural norms and practices through interactions that are established in both explicit and implicit ways. When we are cognizant of these cultural domains, we can intentionally create organizational cultures that are culturally responsive and equity-centered. However, if we are not intentional, organizations are at risk of reproducing the same societal inequities within the service provision relationship. So let's talk about where we can begin. We start by cultivating a critically conscious organization and cultivating critical conscious TA providers. Critical consciousness is an active and persistent state of awareness that constantly seeks to unearth taken for granted norms that are often unexamined. Instead, critically conscious TA providers examine these norms for ways that unmask institutionalized inequities, privilege, and oppression. The first step in cultivating critical consciousness is self-awareness. That is the recognition of one's social identities and the ways in which those identities interact to shape sense of self and living, learning, and working experiences. We all embody multiple social identities. These identity markers give a person a sense of who they are based on their group membership. Our social identities often shape our lived experiences and our worldview. Certain social identities are privileged in our society based on societal cultures where others are marginalized. Most of us embody both privileged and marginalized identities. Some of us possess more social identities that are marginalized than those that are privileged. It is important that as service providers, we recognize our own multiple identities, as well as recognize and value the multiple identities of the children and families we serve. Intersectionality, an analytical framework conceptualized by Kimberly Crenshaw, helps us understand how people who possess multiple marginalized identities experience intersecting and overlapping forms of oppression. Critically conscious practitioners appreciate how specific families whose members embody multiple marginalized identities experience intersectionality and engage TA supports in response to these challenges. For example, for this parent and child, a critically conscious practitioner considers not only the specific educational and therapeutic needs of the child related to their delay or disability, but also the systemic barriers that the child and their parents may face due to ableism, and how their experience of ableism is socially mediated by racism and sexism. In addition, depending on the child and the family's other social identities, their lived experiences in terms of their ability to access resources and opportunities may also be affected by additional societal barriers due to lingualism, heterosexism, or classism. Critically conscious TA provision is concerned with how power and privilege play out in the home, community, and early intervention practitioner relationships. Demonstrating critical consciousness is self-reflective and occurs at the individual and organizational levels. At the personal level, we ask, how might my social identities be affecting my interactions with this family? At the organizational level, we ask, who's benefiting from the way things are and who's not benefiting from the way things are? How might the ways of being and doing in our organization create barriers for families to accessing and benefiting from our services? Being a critically conscious practitioner in organization requires an intersectional approach. It means recognizing the whole person, and in doing so, we consider the multiple identities embodied by children and families. We appreciate their unique lived experiences, specifically how disability is mediated by their other intersecting identities. We recognize the assets, strengths, as well as the barriers children and families navigate due to overlapping marginalizing systems, such as ableism, racism, and other systems of oppression. We recognize the varying risk of experiencing macro and microaggressions that some families experience due to racism, ableism, and other systems of oppression. We value the cultural practices and histories of our families. And we demonstrate an understanding of the dynamic and evolving nature of cultures. I close with a quote by writer, poet, activist Audre Lorde. It is not our differences that divide us. It is our inability to recognize, accept, and celebrate those differences. Thank you.